Doc Sharky. I'm a critical care and trauma doctor. Let's dive into the devastating injury that Lindsey Vonn suffered. She's put out some photos on social media, which we can take a look at, especially her x-rays, which really underlie the seriousness of her injury. Not to pull away from the fact that she's, of course, been through quite a lot. She's already had a knee replacement done on the other side. She sustained a anterior cruciate ligament or ACL injury before this event, and because of all these factors, her long-term mobility and as a result, the long-term health is going to be at risk. So let's take a look at some of the photographs that have been coming out, which she's put out herself. So we see Lindsey here in the hospital after initial operation, where they have put what we call external fixators onto the parts of her bones that have been broken. So these are sort of rods outside. They're fixed to the bones inside. And what this is just a temporary measure. Once she's initially sustained her fracture and her injury, there's going to be a lot of swelling of the muscles and the surrounding structures. So, or to let that swelling come down, but to make sure the bones sort of stay in place, they put these rods which are connected externally. So it's called external fixation. So she's had this done. As you can see, it's quite extensive, and it extends, I believe, up into her femur. So that's going to be, that might be because the fracture involves the knee joint itself. And we could take a look at the x-ray following her operation, which she put out kindly for us to see. So here's the x-ray that Lindsey put out on social media. This is following her operation, and you can see there's a lot of metal work there, and that's quite concerning. So we didn't see any initial x-rays of the injury before the operation, but if you take a look, there's certain things that are quite striking to me. So it looks like it's a complex fracture of the tibia and the fibula as well, the sort of your shin bone and the small bone beside it. And I'm wondering if there's any extension of this fracture into the joint itself as well, to the knee joint, which is always of concern. So you can see there's the tibia is essentially shattered. That's what's happened. I bring up an image of a similar, but this is not Lindsey Vonn, but this is of another patient who had a similar sort of picture. You can see this is the kind of fracture where we're sort of talking about. It's sort of what we call a comminuted fracture, or where the bone breaks into several pieces, and it's not just a clean tibial fracture. So I'm wondering, the mechanism, it would have been sort of direct force onto the side of the leg. It would probably been a transmitted energy from sort of down here, sort of the foot striking the side of the hill or the ground, that would have transmitted the force upwards, causing this area to shatter. Of course, this is not Lindsey's injury, but it's quite similar, I think, in its nature. If we go back to Lindsey's x-ray, and we'll take a look at a few things here. We'll go back to Lindsey's x-ray, take a look at a few things. So let's take a look at a few things in Lindsey's x-ray. So what you see, these sort of solid objects, these are the plates, and you can see the screws going in. So she's got, looks like 3 plates extending along the length of the tibia, and you can see there's 2 on the sides, and there's 1 at the back or the posterior aspect of the tibia itself. And so these are holding all the fragments together, and you can see this extends pretty far up, almost to the sort of what we call the plateau of the tibia, or up to almost the joint. And this is concerning to me, and I'll get to this later. And the other thing that's concerning is the fibula, which is this long bone here by the side of the tibia, and you can see it's also got a fracture, sustained a fracture here. Most importantly, there's this little sharp bit that's protruding here. Now that's also concerning. Now, when you have a fracture or a break in any bone, there's lots of things you have to consider about. It's not just the bone itself. It's not just the muscles and other sort of ligaments around it. There's the concern about what we call a neurovascular injury, because you've got blood vessels and you've got nerves that are running, throughout your limbs. And these fractures, especially if they've got sharp edges, they can cause damage. And this little thing here, this little jagged edge by the fibula there is a nerve that runs close by. It's called the common peroneal nerve. It's a branch of what we call the the sciatic nerve that comes from up here, sort of divides here. You do get an artery, the popliteal artery, but I don't believe that's in any danger. But the nerve, it's at risk of being damaged if it's in that region. The fracture's in that area, so that can cause lots of problems. And nerve damage is really difficult to treat. It doesn't get better really quickly, unlike muscles and bones. So that could be something that she needs to watch out. I'm sure they're going to be testing the power and tone in our muscles to make sure the nerves are not damaged, and of course the sensations as well. So those are the kind of the immediate concerns that jump out to me. Just the nature of this is quite impressive. And I did read an account from the trauma surgeon who initially saw her. I mean, they were talking about amputating, the possibility that they might have to amputate her limb. Of course, I don't think that's unless there's a severe damage to the muscles, there are muscles dying, there's damage to the blood vessels, and that I don't think it would have been that bad. But of course, he or she has said this, so I'm just wondering, how bad it was initially. I do trauma surgery as an anesthesiologist, so I do see these sort of situations pop up from time to time, and this is pretty bad. As regards to the sort of the long-term effects, this is where I don't think she's really thought this through, especially when she's been gung-ho on trying to get her spot. And I know there's been a lot of controversy there as well. Some people have sort of criticized her for trying to take somebody else's spot, especially since she's a bit senior now in terms of her years in the sport. But I think she hasn't realized how these injuries are going to affect her as she gets older, especially since she's already got a knee replacement on the other side. And I see this in a lot of patients who come to us, because we very rarely do knee replacements on both sides. We do one at a time, and this is usually in elderly patients who've got what we call osteoarthritis. We replace their knees. What tends to happen is they sort of weight bear in an asymmetric fashion, so they weight bear to the side, and this has a bad effect on the weight bearing side. So you get uneven wearing and tearing of the joints. Now she's got sort of complex joint injuries here, and especially she's already torn her ACL before this, and she was saying that the ACL injury didn't contribute to this present injury, but I think there might not be much truth to that, because the ACL is quite an important part of maintaining the joint stability of the knee joint. All the ligaments, the collateral ligaments, the ACL, the PCL, they all play an important role in maintaining the stability of that joint. You take one away, you're definitely going to have an unstable joint, and I can pretty much guarantee that ACL injury had a role to play in this devastating fracture. So maybe she should have thought this out a bit more before going into this. I know it's really brave of her in one way. Like, I wouldn't do that if I was in her situation, but it's a bit foolish as well. So what are the problems she's going to have? Now, I can take a look at the joint. I'm not an orthopedic surgeon, but you can see her joint looks fairly okay. There might be some evidence of early osteoarthritis coming in here. You can see a little bit of uneven surfaces of the joint. The joint space looks fine, which is really good. It's not constricted. But saying that, she's had a joint replacement on one side, on the opposite side. I'm pretty sure at some point she's going to need a joint replacement on this side as well. But with all this metal work encroaching on the tibial plateau here, the orthopedic surgeon who's going to have to sort of put a joint, an artificial joint, is going to have to be really careful. So what happens is they'll shave off bits of these bones, they'll put the two artificial joints in, but they've got to go into the existing bone. And when you've got all this metal work going in, that's going to be really tough. So that's going to play havoc when the time comes for a joint replacement. And then you have this sort of uneven gait, uneven weight bearing. The other problem is going to be it's going to affect her hip joints at some point. I've seen this 1,000 times with patients who come in for a joint replacement. It's not just your knee joint, your hip joint, especially as you get older. When she hits her 50s, 60s, especially when you get to that menopausal age, you're going to be in trouble. Your mobility is going to be affected, especially since she was an athlete before. Hopefully she'll have some reserve left, but as soon as your mobility is affected, your whole health goes, down the drain. And that's what concerns me about these athletes who take these kind of risks. And, it's kind of scary to me. But of course, it's an Olympic dream, and she went after it. But now she's going to face some consequences. But it's quite a nasty injury, and hopefully we'll hopefully she'll recover from it, and there won't be any long-lasting implications. But I wouldn't be so sure that there won't be. And as far as future surgeries, other surgeries, so this metal work is going to stay in with her. It's not going to come out unless there's some problems like, God forbid, infection or something like that, or there's what we call a periprosthetic fracture, or she gets a fracture because of these plates. Then they might have to go in and do something. But at this point, of course, she just needs to recover. I think she's had multiple surgeries. I'm not sure. So she's going to have a long road ahead just to get back on her feet, and then she'll probably have to deal with all this stuff for the rest of her life. But anyway, wishing her all the best. I hope she gets all the best attention that she needs, and she'll be back on her feet soon. So anyway, let me know in the comments what you think. Do you think it was selfish of her to have gone in gung-ho and may possibly excluded somebody younger, maybe a bit healthier, with no pre-existing joint injuries to take part? Or do you think that she did the right thing, she followed her dream, regardless of the consequences? She's had her shot. So let me know in the comments, and if you like this sort of thing, please remember, give us a like, give us a subscribe, and stay healthy, stay safe. I will see you in the next one.